specifically. And today's call is going to be mainly focused on practice management. We have some great people here with lots of wisdom and experience that are going to be able to give you guys a lot of insight in terms of what practice management looks like at Aspen Dental. We have two practice owners, we have a territory director, and we also have my colleague Brett Sieber, who's also an academic relations manager for a different district. But to start it off, let me tell you guys a little bit about me. I cover, again, District 4. So I'm pretty much the Aspen rep that hosts events, sponsors events. I work closely with ASDA and other big organizations within the dental schools. But I cover Tennessee, Virginia, the Carolinas, and Georgia. Um, I live in Fort Mill, South Carolina, and I've been with Aspen for almost 4 years now. Um, and with that being said, I'll let my colleague Brett introduce himself a little bit, and then we'll just make our way around so you guys know a little bit more about us and what we do.
Hey, everybody. Thanks, Sammy. And again, thank you, everybody, for joining. My name is Brett Sieber, and I cover District 6. So that's Ohio, Michigan, and West Virginia. I currently reside close to Syracuse, New York. That's where Aspen actually was founded and originated. I'm about 30 minutes east of Syracuse. We still have the practice support center out there as well. But yeah, I've been with Aspen Dental for about 2 years now. Again, Sammy and I, we obviously counterparts. We cover a lot of the country, even though we have our assigned districts. We cover certain aspects and help each other out across the country. So just here to answer any questions that you guys might have, and looking forward to a good conversation. Doc, you can go
Awesome.
next.
Thanks, Brett. Megan, if you want to go ahead and just introduce yourself and tell us how long you've been with Aspen and what you do for Aspen.
Sure. I'm Megan Jones. I am the director for North Carolina. So my primary function within the organization as it stands right now is really to support the doctors in all things non-clinical. So my goal is to make sure that you have a great onboarding, you've got a great onboarding plan, that you know how you get paid, and everything else is easy so you can focus on your patient. So my team are my regional managers who are with you day to day in your office and go all the way down to your office managers. I've been with the organization for 9 years. Started as a float office manager and dental assistant. Realized I was a terrible dental assistant and really good at operations. Stuck with that, and it led me pretty well. I was an RM for a few years before I became the director of North Carolina.
Awesome. Thank you, Megan. And then since you were speaking about onboarding, I would think this is a good time to introduce our onboarding team here. We have Paula and Brianna. Brianna, if you want to go first and just kind of telling us a little bit about yourself and what you do for the organization.
Absolutely. Hi, everyone. My name is Brianna Whitney. I am currently a doctor and onboarding experience coordinator with TAG. I started about 4 years ago with the organization in the offices down south. I did treatment plan coordinating in the offices directly with Dr. Gia, actually, so that was pretty neat, and transferred over into HR, but I'm happy to be here.
Awesome. Thanks, Brianna. And then Paula, yourself.
Hi, everyone. I am Paula DuVernay. I'm based in New York, and I lead the onboarding function here at Aspen. I connect all of the dots between all of the different departments. I've been with the organization for about 8 months now, and I cover all of the states.
Awesome. Thank you, Paula. And then Brianna and Paula are actually going to share a little bit more insight as to what they do and how they help handle the transition for our waiting to start doctors towards the end of the call. If you guys make sure you stick around for that to learn a lot more about that. But then now let's move into our doctors and learn more about you guys. We'll start off with you, Dr. Gia.
Hey guys, I'm the owning doctor of the Albemarle office in North Carolina. I been with Aspen for 6 years now. Started straight out of school in 2017. I worked up from an associate doctor to an MCD, and then I left Aspen during the pandemic and came back to move when I moved up to North Carolina to work with Dr. Elajic. I was his MCD for a year, and now I'm a partner doctor with Aspen now.
Awesome. Thank you, Dr. Gia. And then Dr. Elajic, if you could give us some insight on you.
Of course. So I started with the company in 2017. I started in Florida for about 2 years. Came to Charlotte, North Carolina, where we're currently at. Practice owner, multi-unit practice owner here. I am part of your entire doctor journey, where I take it upon myself between Dr. Gia and me, we want to make sure that you're set up for success as new doctors. Onboarding, like I announced earlier today, we did just get a new doctor that is also a DJ on the weekends, and he started Monday, so we're very excited for him to come be part of our team. But my job is mentorship. My job is making sure that everything clinically goes smooth.
Awesome. Thank you, Dr. Elijah. Thank you, everybody, for the introductions. So as you guys know, today's session is going to be on practice management. I know this is a topic that's not really talked about a lot in dental school. So I would ask all of you to take advantage of this time, use the Q&A option that you have in here, and ask as many questions as you can. We have some questions and topics that we want to start off with. But as you guys are listening to Dr. Elijah, Megan, Dr. Gia, I would definitely ask you guys to ask as many questions as you can and learn as much as you can. Um, and then I'm also going to ask my colleague Brett to keep an eye on that Q&A and see what questions are coming in. But I know you guys shared a little bit of your journey, but if you could kind of go into more detail and just explain what Aspen has been like for you since you joined. And we'll start with you, Dr. Gia.
So Aspen for me has been pretty amazing just with the amount of resources we have. Fresh out of school as an associate doctor, you get a really great advantage learning from someone. So there's someone with your chair side. So in the beginning, when I wasn't sure about a crown prep or I didn't know what the right move is for the next patient, I had someone to ask that was in the room with me every single time. And then as I learned and I grew and I became more and more independent, it was nice to just someone to bounce ideas off of. So being an associate doctor is a really great aspect of it because you have someone to mentor you in the office. And once you kind of get your sea legs under you and you know what you're supposed to do, you elevate to a managing clinical doctor where you become the lead doctor and you can mentor someone else, which is a huge advantage. There's a lot to learn. There's a lot to how to operate an office. You're working as a practice owner, but you still have that mentorship from your POP owner, like in our case, Dr. Elagic. So having an MC like that, or having an MC system like that has been super helpful. And then even moving up to North Carolina, being his MCD for a year and becoming a partner, it's a very collaborative effort, which we work together and see how we can drive the business forward, making sure patients are getting the best care possible and making sure that team is successful, patients are successful, and then we're doing good dentistry at the end of the day.
Awesome. So a big question that's always asked by students when I'm traveling is, how long does it take to become an owner? How long does it take to get promoted to an MCD? So how much time did you spend in each role?
So I started working in June 2017 as an associate doctor, and I became MCD in December 2018. So about a year and a half. Everyone's journey is going to be different. So there are things that you'll excel at and things that you'll have time to improve on. And so about a year and a half is typically the average to advance to an MCD position, but it can vary from person to person.
Gotcha. Sounds good. And then Dr. Elijah, what has your journey looked like since you've joined Aspen?
So in 2017, I started as an MCD in Pinellas Park, Florida, Tampa Bay area. Roughly about a year and a half into it, I started seeking opportunities to become the practice owner. And I really wanted to explore the country. And I did. I went to different cities from Austin, Texas, to certain ones in Alabama, certain ones in different aspects of Florida, all the way up to North Carolina and even Virginia area, right? And exploring these areas made me just comfortable on deciding to really take this route. I have zero regrets. It's been a wonderful journey since starting my first office in 2019. And I think the biggest piece that really ties everything together and makes this company special are the resources that we have that Dr. Gia spoke about, the CE courses along the way, whether you just want to learn how to take a tooth out properly or do all on 4 implants, right? The dentistry aspect is there, the mentors are there, the courses are there. Just recently, I became a faculty member at our Oral Care Center of Excellence, and it's been very eye-opening to just see myself, oral surgeons, other practice owners come together for the greater good of just teaching the nation on how to properly treatment and plan and do guided and free-handed implants in dentistry.
Yeah, absolutely. The oral care center, just so for those of you that don't know, it's a new oral care center that was just built in Chicago. And it's an opportunity for all of our clinicians to come out there and learn. More complex cases, like Dr. Elagic was just saying. Um, so there is a question that just came in. Oh, Megan did just touch on it and answered it. What is the pay increase from associate to MCD?
I can explain it a little bit more if you want me to, Sammy.
Sure, go right ahead.
So there's two different ways that we kind of pay doctors, right? So every owner, so Dr. Gia and Dr. Elijah, they're going to pay their doctors, and it may look a little different for another doctor depending on your daily rate. So every office matters, and it does depend on the owner you work for, but your percentage is the same. So whether you're North Carolina, Virginia, or some of the other ones, it's your profit share percentage is the same per position. So your daily rate might vary, but where you're really making the bulk of your money and where you see the biggest difference from an associate to an MCD is in your profit share percentage. So your profit share goes from 8 to 10% on a sliding scale when you're an associate to 16 to 20% sliding scale when you are an MCD. So the great news about this is in both roles, you guys are working together as a collaboration. So you are being paid off the total of the office, not just off of what you can produce. So as an associate, most of our newer grads and even some of our newer doctors who practiced previously coming in there, it takes them about 4 to 6 months to get ramped up, get really comfortable with the team and with the office. But if they're coming into an already established office, they're already being able to earn at a higher level than they would if they were going into an office solo without somebody else there because of the way we do the profit sharing. So the nice part is it's, again, a total collaborative effort versus it just being on one. So the biggest difference in pay would be the percentage scale.
Awesome. Thank you, Megan. I have nothing else to add to that.
That
So
was a great answer.
the next question we're going to go into is more practice management focused, which is what we're all here for. Do you have to have a certain amount of practice management experience before you own a practice? And Dr. Elijah, we'll start off with you.
You do not. And it's always welcomed to make life a little easier, in my opinion, but you do not. You rely on someone like a Megan Jones. She's pretty much my counterpart to my life because every problem that I have, she has an answer. And then if she doesn't, she will find someone that does. And that type of reassurance to me is priceless. So long story short, no, you do not have to have any particular experience. The nice part is you grow with the company. There are pretty much courses where we teach you. There's a whole doctor journey where you get sent to Chicago, spend a week up there, and then a follow-up doctor journey part 2, 6 months following the first one, where I think the best part that we really made awesome this past year or so is creating that doctor journey so structured to the point where I know that my doctors are not only learning from myself, my managers, my regional managers, my directors, but they also get to experience it with other associates, MCDs, practice owners across the whole nation.
Awesome. Dr. Gia, is there anything you'd like to add?
Yeah, becoming that jump from MCD to POP wasn't a big stretch. I wasn't like shocked or surprised by anything because it's more of your day-to-day, how to run the office efficiently, making sure that you're not wasting materials or wasting hours and stuff like that. But these are things you pick up as you work. There's a lot of on-the-job training as you learn. But when it comes to P&Ls and metrics and numbers like that, you have people like your regional manager, Megan Joneses, who can break everything down for you, who you look at and explains every line item one by one. And you do it enough months and it becomes second nature to you.
Awesome. So there is a question that just came in associated with what that jump looks like. So Jasmine is asking, if I'm an associate to an MCD, do we make our own schedule or do we have to go through regional director regarding our schedule availability / changes?
I
Megan,
can
do you
take
want to
that
take
one.
that? Okay.
Yeah, I could take that one. So I think it's a twofold piece. So you definitely are going to want to partner with your MCD and your owner doctor first. And then really what my team does is we're going to help make it actually effective on the schedule. So we're scheduling correctly. So there's two parts to it. I think we want to make sure there's a doctor there and we can provide the access to care that the hours that the practice is open and set. So if you need to make a changes to that, then I'd start with the clinical team of providers around you first, and then my team will help. If for whatever reason we need to get a temp doctor, or maybe see if another doctor from a surrounding office can come and cover because of an emergency or things like that, that's where my team can come in to help be that liaison. But that would be the first thing. And a POP is our acronym. You'll probably hear a lot of them. So if you hear us say one, feel free to ask it. We forget at Aspen that you guys have no idea what we're talking about half the time, because we really love acronyms. It's our favorite thing. But a POP is pretty much short for an owner doctor. So it's a practicing owner doctor that's your practice owner. So just like in a private practice, the person who owns and signs your checks, that's what a POP is.
Yep, exactly. Spot on. Thank you, Megan. But yeah, so pretty much the journey looks like you start off as an associate, you get promoted to what's called an MCD, managing clinical director. That's pretty much just a lead dentist. You're able to be in the office by yourself. And then from there, you have the opportunity to partner in an office with the current owner or relocate and own your own office. Um, but okay, so what does the average staff look like in an Aspen office? Um, Dr. Gia, you want to take that one?
Yeah, so in my office right now, we're a 2 doctor practice. It's myself and my associate doctor. So we have a total staff of 12. We have a front desk. We call them a PSR, patient service representative. We also have a TPC, a lot of acronyms. That's a treatment plan coordinator. That's the one who's going to go into the operatories with you while you're talking to a new patient, making sure that they're breaking down barriers, understanding what the patient's going through. And so whenever they have that financial conversation, that treatment plan coordinator's in the room. They know everything that the doctor knows as well. And so my office has 2 of them. Some offices will have 1. And then there's a practice manager who is, like the office manager of the practice, who is just making sure that the day-to-day is running well, running over insurances, numbers, any front desk clinical stuff. I mean, front desk clerical stuff that I don't know anything about or aren't involved with at all times. There's my associate doctor. I have 5 dental assistants. So he has 2, I have 2, and then we have 1 that floats. And every day we have our assistants switch off so that they're familiar with my habits and my preferences, and they're familiar with my associates' preferences. I have a hygienist, and then I have a lab technician as well. What you'll learn about Aspen is that more or less every single office has a lab technician, which is probably the most under talked about position because it makes your life so much easier when it comes to dentures, because no one liked dentures in dental school, but that's where dentures have become really, really easy.
Awesome. Thank you, Dr. Gia. So here's a more general question, and it was brought up earlier in the chat I saw. What are your responsibilities as a practice owner? Dr. Elijah, do you want to take that one?
So practice owners manage pretty much, it's people management, it's clinical skill. You are the owner of the practice. You have to own the process. You have to establish a culture, and you have to bring that to the table. It's not going to be done for you, right? You team up with your director, your regional manager on how you want that to be, what your vision looks like. But for example, my main responsibility right now is I have 3 doctors in my office. One is actually opening up my next office in about 2 days. He's been training with me for the last 3 months, and I couldn't be more excited for him because he's ready to get the ball rolling. He's sick and tired of waiting for the grand opening to cut that ribbon and get the ball just going down his way. And right now, that's my main focus. I have another doctor that I'm training for, actually the state of South Carolina. And then I have my associate in that office as well, where my goal is to make sure that their doctor journey would not have been better anywhere else, that they're set up for success, and that we ease into dentistry, we learn about it, do it, and own it.
Awesome. Dr. Gia, anything you want to add on in terms of responsibilities as an owner?
Managing people and managing and mentoring doctors is probably his #1 job, and then just helping out around the offices as well, being the go-to person for clinical stuff. When Dr. Elagic was on paternity leave, I stepped into that owner role. So when Other doctors had questions. Oh, hey, what should we do with this step or this step, or how can we go about this problem? They called me and I was able to answer their questions for them, just because we've had a little bit more experience. I mean, he and I have both been working since 2017, so we've seen a few things here and there, and we want to share that knowledge with you, the new doctors.
Awesome. And yeah, I think this is a good question asked by one of our guests. How does the practice handle continuing education and professional development? So obviously you guys are owners, you have doctors that you're responsible for. How do you, handle that, making sure that they're getting CE and getting that professional development that they need? Dr. Elijah, I guess you can start us off.
Of course. So besides our pretty much nearly quarterly, we'll bring in a vendor, we'll do a CE somewhere at a nice restaurant, and it'll be a good time where we just get to relax and bond after hours. Aspen by themselves, they offer the new Dr. Jersey. They offer denture courses. They offer Motto, which is our clear aligner courses. We have the OCC for extractions, implants. We actually have trips to Alabama, to Mexico, to Chicago, where we do offer hands-on CE. We also have leadership retreats where we do send the leaders of our organization to actually partake. And on those weekends, you do earn anywhere from 8 to 16 CE courses, right? Depending on how much you really want to take advantage of it. I saw someone asking questions about implants. We have a part 1, part 2 continuum online, which adds up to over 80 CE credits just by taking those 2 courses. Then you take up part 3 live in person. The journey is endless. We have a library called Blueprint on how we can take more CE credits. And then there's partnerships with Dr. Bicuspid and different organizations where it's honestly endless. The world is literally your oyster when it comes down to CE courses. And the best part is all of that is genuinely included. There are some special courses where you do have to pay for them, but we even have reimbursement offers where you can take a pretty much 4-day, 3-day course, depending on the location. And if you place a certain amount of implants afterwards, you get that money reimbursed. And it's awesome. Like, you're set up for success, and it really comes down to how eager you want to be.
That's awesome.
One of the things, Blueprint is so great. I think at our last meeting, they said that Blueprint offers more CE credit hours than any other organization or any other group in the entire nation. So yeah, Blueprint is one of the most underutilized things, because there's like Dr. A was saying, there's so many different topics that you want to master or learn about. I mean, I still take refresher courses every now and again. I'm doing a CBCT course that they offer once a month on the first Tuesday of the month. So I was like, hey, I forgot how to use this feature on the CBCT. So I took that course, and great refresher course, and it's all free to us, which is a huge, huge, huge advantage.
And it evolves too. I think that's the other great thing, is that like the library doesn't stop growing. So right now, like Dr. Elijah and Dr. Gear, they were one of our first doctors to jump on the digital denture train. So we were the first, we still are the first state to be fully digital within Aspen Nation. But these doctors helped pioneer it. So in the early days when we were trying to figure out what materials were going to work and all that, these guys troubleshooted it and made it work and got us to the point that we're at now, where we can deliver, a Lucitone denture for an overdenture, and they're beautiful. But there's courses in regards to that. So as we're growing that part of advancement from technology, there are CE courses that go along with it. So it doesn't stop at that piece either. It always grows with the evolution of technology as well.
Yes, and it's also piloted to a certain amount of Aspen Dental practices first before it's actually fully released to everybody in the nation. And there's over 1,000 Aspen Dental practices across 43 states. So you kind of get to work out the kinks before everybody is able to use it, which is also great. But here's another good practice management question. What are the key performance indicators or metrics used to evaluate practice success? So we are very big on metrics at Aspen, and I think this would be a good question for Megan to dive into.
Yeah, so we have over 400 plus KPIs that technically I could pull and run for you at any point. So if you want to know how many intermittent, like how many partials you're doing from acrylic versus a full cast partial. I could run you that report and tell you. But that's more to say, like, we really hone in on a couple of really important ones. So the biggest ones we're really looking at are going to lead us to the behaviors that are right in the practice that we feel are the most important, that if we're doing these things right, everything else falls into place. So a couple of the big ones that we really look at, the first one is what we call our yes to today. So it's how many of your new patients walk through your door and accept treatment either the same day or schedule an appointment within the next 60 days to come back. And we're really looking at that because that means we nailed them down. We've got them in here. We're going to have them come back. So it shows that you're going to have that patient bought in and that you're going to have continued care to go through. So that's a big one that we really look at. Another big one that we look at is also going to be that sets us apart is going to be from a financial side. So we actually look at our percent for your office teams. This is where we come into support, which is going to be, we know most of our patients, the number one reason that they didn't say yes previously was financial. Right? There's a fear component for sure, but most of the patients you see after they get through your exam with you, they made it through the fear factor. Now it's the financial factor. So we really look at our financing applications. We have 4 different lenders that we utilize that can help patients get almost 80% of our patients can get approval some way, which is pretty cool when you think about the treatment plans they're writing, especially these 2 docs who do implants and some pretty advanced surgery. So those can get pretty big from a treatment plan cost. And we have options outside of just care credit that really break it down on a longer term for our patients to where it makes it affordable for them. So those are some of the big ones that we look at. There's a ton of other ones, but those are ones that we really look at for the health of the business because we know those are going to extend out to get you where you guys want to be financially, as well as making sure that the patients are getting the care they need today versus having to piecemeal it together.
Awesome. Thank you, Megan. Dr. Gia, any metrics that you like to really keep, focus on and pay attention to?
The one that I think everyone associates with me whenever they say Dr. Gia is patient satisfaction, because I want to make sure that every patient who walks into the door is having a good experience. And if they are having a good experience, I want the office to know about it. I want Aspen to know about it because that means you're doing something on the right trend. Everyone's seen dental offices that have 2 stars or 3 stars, and you don't want to be that because you want to make sure the patients know you're treating them right. You're going to have a good experience, and they're going to be pleasantly surprised with, oh, that wasn't as scary as I thought, or wasn't as expensive as I thought. It wasn't as I shouldn't have been afraid. That doctor's pretty goofy. He plays music when he does his surgeries, and I had a terrible, decent experience when they're having extractions or fillings or crowns or whatever done. So that's one of the things that I look at more than anything is to make sure that patients are having a good experience overall, because patients want to go. When we check restaurants, we want a 5-star restaurant. I want my patients having a 5-star experience so that it attracts more patients to come through the door.
Awesome. Yeah, couldn't agree more. Dr. Elijah, any metrics that you like to focus particularly on?
No, they nailed it. Since this is a practice management, topic session, right? Something that people don't realize is the metrics run your business and they tell a story. And one specific metric that a lot of companies don't really take seriously is days to first appointment. How long did it take you to get that new patient that called in through your doors, right? Because if they have an emergency, it better be low. It better be today, right? Come on in, we got you. If they're just chilling, they just want a regular checkup, you still shouldn't take 3 weeks to see them, right? So that's a metric that I take very serious because at the end of the day, we live in a world where a lot of today's generation is, I need it right now because it's on my brain. And if I don't do it right now, I'm not going to want to do it in a couple weeks, right? So they're going to find the next best thing. Don't allow them to walk away from you. Figure out a way to do it. And I personally love the way our metrics work because I have pretty much a metric that predicts if this patient is going to show up or not. And it's become very efficient to the point where we can minimize that waiting period, take advantage of it, and be the best providers we can be.
Awesome. Thank you, guys. And then the next question I want to dive into is, do you delegate the majority of your practice management responsibilities? If so, who are the key members? Dr. Elijah, we'll start with you on this one.
Dr. Gia.
Yeah.
So he's my go-to. He's my ride or die. He's my partner, right? And when I had my baby just last December, he took over. He allowed me to get my peace of mind, right? And Dr. Gia was my clinical support. My regional manager was my support in every other aspect of it. And the best part is, we promote you to take time off. We want you to take a vacation. We want you because you deserve it, right? We got you in that aspect. Vacations are welcome. Dr. Gia just went to Greece. He's expecting a child. He knows I'm going to reciprocate because I got him. And that's just the way our lifestyle works, where the best part about it is you can go on vacation and you don't have to worry about what treatment you're going to lose, who's going to see your patient, finding a backfill, and worrying about what the heck is going to happen while you're gone, because we're all in this together. I know that my group of doctors are very tight knit. They got each other. God forbid there's an emergency, someone steps in, right? And there's been times where I've even left my own market and drove to Hickory, which is an hour and 20 minutes away, because that doctor had an emergency and he needed to go back to Florida for one of his parents, right? So the best part about it is we have a system here. It works. It's awesome. And again, vacations are welcome.
Awesome. All right, Dr. Gia, how about you? Do you delegate majority of your practice management responsibilities? And if
I
you
want to,
do,
whatever, yeah,
who
whatever I do
who do you
delegate.
delegate?
Yeah, my office manager is my number one person in the office who knows what's going on. She's my boots on the ground. And then also my regional manager, she comes to my office at least once a week. And so if I have any issues or run into any problems, she's aware of it. But the thing is, whatever I do delegate, I have an ear and I know what's happening. So I don't have to maybe micromanage the situation. But if they're going to go handle the problem, and then they'll tell me, hey, this is a resolution, or this is how we dealt with it, or these are the numbers that came from this incident, or this is this patient's treatment plan. So yeah, we delegate, but we're also very much involved in it because I want to be involved with it.
Awesome. All right, so somebody's asking in the chat, what does the typical work schedule for an associate look like? Megan, you work with all the owners and practices in North Carolina. You want to kind of talk about what that looks like?
Yeah, I was putting an update in there. It's tailored to the person. So I would say, guys, like we're not a one size fit all. As you can see, like Dr. Gia's needs and Dr. Elijah's needs are very different from each other, even though they are new into fatherhood and they kind of have a similar journey. What their family needs and what they want to accomplish from a professional level are different. So it does tailor to you. So we look at two things, what personally you're trying to accomplish and how work works into that. Because we all fully believe if you're not effective at home, you're not effective at work. So that's the first thing. And then secondarily, it's going to be around your clinical skill set. So when you think about like your hours of your schedule, how many days you work, that's really up to you and your owner doctor or your whoever's hiring you of what that looks like, of what you guys decide is going to be the right fit. And then regardless of what your schedules look like, that's something that's going to continue to evolve over time. So it really does depend on where you're comfortable, what are your guardrails, how long do you want for things. And even my most experienced dentists, when they first come in, you got to get to know your team, where everything's at, how quickly your DA goes, the new technology, the system. So we vary those times a lot. So it is very much tailored. No 1-2 schedules look the same. They all look very different based off of what the doctor does. So we tailor it to you.
Awesome. Spot on.
And then perfect answer. I was gonna just hop onto that too. Like when my new doctor started, I wanted him to shadow me, just see how I interact with patients, because the verbiage that we use in dental school versus the verbiage we use in an office is very different. So how is my experience with the patient so that they can learn? And I want that new doctor to learn from myself, from Dr. Elagic, get as many experiences as possible, because my new patient experience is an amalgamation of Dr. Elagic's new patient experience, my other mentors that I've had. And so that's the doctor I am, is just experiences from other mentor doctors. And so I want my associate doctor to be exposed to as many doctors as they can, learn all the best habits they can. And then from the beginning, start off slow. What's in their wheelhouse? They want to do a filling. Do you want to take 2 hours to the filling in the beginning? Go for it. Just give me the best damn filling you've ever done. If you need an extraction or a full mouth case, you know, if you want me to be over your shoulder and do it, we can block off time and we can do it together. Or if you're like, no, doc, I got this, but I'll come grab you if I need you to bail me out. I can do that too. So it's up, like Megan said, it's up to what the doctor wants or what type of experience they want. But no one's throwing you into the deep end because, as she said earlier, the office's production and numbers are based off a collaborative effort. So I could do all the work and the associate can do nothing and just shadow, and we're still going to get paid the same. We can do 50-50 and we can both grow together. That's fine too.
Awesome. Yeah, it's how the practice does. The success of the practice is what counts.
Hey, Sammy, before we get pushed on too far, they have a question going back to the low satisfactory scale within an office. You know, one of the questions was, how does a 2 to 3 star patient feedback impact the associate dentist journey in the first year? We kind of just touched bases a little bit on that, but if, maybe a little bit more in-depth elaboration on how the pathway is as a new doctor with a low patient scale.
So we actually look at it at 90 days. So the reason we look at it at a 90-day scale is because we know you might have a month that maybe you were on vacation, maybe you had a temp doctor covering, maybe it was a not normal doctor, and maybe they were great, but your patients, they wanted you. So you might have had that one older lady who was really upset that you weren't there to do her denture adjustment, and she just gave you a 1 star because you were on vacation. We take that into account. So we look at 90 days. That gives us a much more balanced view versus looking at where it could get volatile month by month. So we look at that 90-day scale. So it is more true. And it accounts for those fluctuations. So as you're coming in for a new office, if you get to start from scratch. If you're coming to an existing office or as an associate, I think the question is, I mean, it depends on which one you're walking into, but you have 90 days. So you're going to see those start to fall off as they continue to progress, and you're not looking at this. So as you're making good things, you're going to see it continue to get better. If you're maintaining it, you're going to see it stay that way. We don't want to see it go the other way, so we won't talk about that.
Yes, 90-day trailing average is what we use. All right, so back to practice management. Are there CE opportunities on practice management? I know we touched on that, and if there are, what are some of the courses and what do they look like? We'll
There's not
start with
necessarily a CE that I would say. There are a few that we do as like leadership courses, but when we think about CEs, right now we don't have a CE directed to leadership. We have a leadership course that you can take and you can grow, and we actually do it cross-functionally. But when we think about an actual CE, like you would for like your implant course or things like that, it's not necessarily accredited. Now, I think we're getting pretty close to where we might in the future. You know, with our brand being as large as it is as TAG, that's something we're working really hard about, is how do we grow better leaders across all scopes, not just with Aspen, but through Well Now and through chapter and different cross-functional areas. So I think that's something we're working really hard to, but the CE actual credits would really fall just to the clinical skill sets. And then anything else, we definitely have tons of great leadership components and things that we'll put you guys through and help you support with, but there's not a direct CE to that right now.
Amazing. Thank you, Megan. All right, here's a very general one for our practice owners. What is the hardest part of being a practice owner? Dr. Gia, we'll start with you.
Ooh, that's a tough one to think about. I mean, Dr. A, if you might have to step in while I think about this one.
I got you. People management. Okay. You're allowed to have off days. You're allowed to kick and scream. You're allowed to be mad. Just don't let people see it. Okay? All right? Hide in your doctor office, hide in the bathroom, do whatever you got to do. But be the best version of yourself. Be a leader. Own it. Be someone you would want to follow. And everything else hands out. If you don't show up every day, the best version of yourself, people read that and excuses show up. But if you're there, start to finish, if you're there willing to throw away the trash, if you're there picking up that tissue that was dropped, if you're there going the extra mile for someone in pain, if you're there saying, yes, of course we can see this patient because this is what I stand for, people will follow you no matter where you go. And it's awesome. So my biggest and most sincerest advice is be the best person you can be. The hardest part about being a practice owner is showing up every single morning. And more importantly, being there for your people when it gets tough, when we don't know what the heck is going to happen. When COVID happened, people needed a leader. if you show up, you build loyalty. If you take care of your people, you build loyalty. But if you take the easy way out, you can expect turnover. You can expect people taking it the easy route, cutting corners, cheating, lying. But if you stand, again, I'm done preaching, but if you stand for it, people follow.
Awesome. Great answer. Dr. Gia, would you have anything to add to that in terms of?
That was perfectly dealt with. Yeah, becoming a leader of people, right? Because in dental school, again, you're responsible for yourself, and you don't even have an assistant half the time, and you see 2 or 3 patients a day. But being able to balance and making sure you give quality dental work every day, that stuff comes easy. The clinical aspect, that will come easy to a point, but it's making sure that you break down barriers so patients understand that you're genuine and true and you care about them. And same thing goes for your staff, because you're a leader for your staff too, because everything Dr. A said couldn't be truer, because they want someone who's going to work hard for the patient. I mean, one of the best aspects of being a dentist is that we can get patients out of pain pretty quickly, especially when it comes to mouth pain. And so showing patients that, hey, I'll stay through lunch to get you out of pain, or, you're walking an emergency and I have a full schedule. Hang out, I'll work you into the schedule. Patients appreciate that, and your staff sees that and they appreciate that too, because staff are like, oh man, I'm working a little bit longer, but they have to understand that we're doing this for the betterment of our patients. And that's the biggest perk.
Love it, guys. Great answers. All right. So Jasmine is asking, does the dentist have say in who we hire for office managers / assistants?
Yep.
Yep.
Easy answer. It's their
Pretty
team. If you have me, I'm going to give you my recommendation because I just can't not. That's what our goal is. So will your regional managers, but ultimately they're your people. So that's the great thing about here. Like, you don't work for Megan Jones. You don't actually even work for Aspen. You'll work for whoever your owner is that you're going to be working with. So you guys are in partnership together of your team and who you're building. Personalities matter, how you're going to blend in. That's really important because you sometimes see these people more than you see your families on some weeks. So we want to make sure that it's people that you're compatible with and that you can do exactly what both Dr. Elijah and Dr. Gia said. Like, are you going to be able to help your patients? And if you're in a state where you can't trust that person, how are you going to be able to help those patients get the care they need, right?
Yes, exactly. And then I was going to ask you guys, Dr. Gia, Dr. Elijah, what does that look like for you guys in your respective practices? I know Megan offers her recommendations, of course, but how do you guys handle situations where you may have to hire or fire somebody?
So I feel like, oh, sorry, Dr. A, but I felt like I've done every version of hiring, hiring based off personality, hiring based off, asking the really tough questions. But what I've learned that matters the most is just hiring good people with the best personality, because you can teach anyone to become a good dental assistant. You can teach anyone to, know the numbers and say what to say to become an office manager. But that person is someone you have to work with every day, 5 days a week. So you want to make sure that it's someone you want to be around, someone who has the same values as you, someone who's going to be there for you. That's the biggest thing.
Awesome. And then Dr. Elijah, how about you?
I hire every single doctor on my team because I take that very personal. And to me, like Dr. Gia said, it's all about their personality, their drive. Are they a good person? Benevolence, right? If at the end of the day, whether you have a new grad experience or 10 years or 20 years of experience, I've seen a whole rainbow there. It comes down to what's in here, right? So I tell docs all the time, personally, whether you have 0 experience or all the experience, I just care that you're going to do the right thing at the end of the day. I can teach you how to be a dentist. I know I don't look like I am that old, but I can teach you how to be a very good dentist. But I cannot teach you how to be a good person, So that's my drive there. As far as the clinical team, the front desk team, I delegate that now to my regional manager, the individual managers, the individual MCDs. Why? Because at the end of the day, my manager and my MCD are in that office every single day. I am not, right? So I need to make sure that they fit that culture. I have several practices, each one with a different culture, each one with a different drive, each one with different motivation, whether they want to celebrate with food or outings, right? or winning our annual kickball tournament, right? Everybody's driven differently, and it just comes down to making sure that you're supporting your team, not attempting to micromanage it from afar.
Love it. Awesome. All right, here's a good question. So what does the patient flow look like in your offices? Dr. Gia, we'll start off with you.
So we have 3 main columns. One column is for new patients. Every new patient goes through more or less the same experience. They get a great welcome call. They get greeted by the assistant. X-ray, FMX and Pano are taken. They get an intraoral scan of their mouth. Hygienist will pop in, do their perioprobings, and then the doctor will come in with the consulter and explain the process of what the patient needs. So that patient process is blocked off for about an hour. So 10, 15 minutes, 10 minutes for the X-rays, 5, 10 minutes for an intraoral scan, 10, 15 minutes for the hygienist, and then about 15 minutes for the doctor to spend some time with the patient. And then the rest of the time is spent with the consultant, going over finances, seeing that they can get say that yes today, and making sure that they can get the treatment that they need. In my other column, I have production, so I'm doing fillings, crown preps, extractions, things like that. Those are your big ticket items, things that require a lot of your time and attention. And then I have a third column, which is denture steps or something small, maybe a post-op. I did a surgery on the patient yesterday and I want to check up on them. So something like that will go in their third column, which is something I may or may not need to be in the room for, but we're checking up on patients and doing things that are fairly quick. And as far as timing goes, we can block it off for as many times as possible, as much as need. If I'm doing a full mouth extraction case and I want 2 hours and I want to train my associate doctor how I'm doing this type of case, I'll block it off for 3 hours and block off his schedule too. So he can be in the room with me and we can do the case together. So that way we're not bogged down with other patients who need to be seen at the same time. So that's what a typical day goes for.
Love it. Dr. Logic, anything you want to add on to that in terms of patient flow in your offices?
No, Doc is spot on. I think the biggest piece that we focus on as an organization is comprehensive patient care. We are not someone you come in and kind of just demand us to do a root canal and a crown on without doing proper hygiene, right? We focus on comprehensive care altogether. We're not skipping through your veneers before your hygiene is taken care of. We're not going to do your treatment where I might do an all-on-4 up here, but these teeth are going to be preserved, but they have bone loss and we're ignoring the active infection. No, right? So comprehensive care is the motto when it comes down to how we treat patients.
Awesome. Love it. So guys, we're getting close to the hour. So any last minute questions, please put in the chat. But before we go, I'm going to provide us with one more question that we have here. As a dental student, what are some areas in practice management that you would place more focus on? Dr. Gia, we'll start off with you.
Yeah. For practice management around, it's just mainly working with teams. I mentioned earlier, in dental school, you don't have that much interaction with an office manager, treatment plan coordinator, things like that. So one thing I wish you learned more about is just working in a team, being in a collaborative effort, because when you're the dentist in the office, all eyes are on you. But you have to make sure that you work well with your partner and with your lab technicians, your office managers, your practice managers. That collaborative effort is super important to the success of the practice.
Awesome. Dr. Logic, anything to add?
No, I'm not adding on to this one. You nailed it.
Okay. All right. We got 2 more questions here in the chat. Let's take a look. Do you offer a pathway to memberships or fellowship for the Academy of General Dentistry? Megan, you want to take that one?
Not yet. So not
Okay.
yet. It's one we're working on. There's a couple of different things that we're working through, but nothing formalized yet.
Okay. And then last question here, before we move on to our onboarding team. Newton. Hey, Newton, how are you, man? Do you have a saying of hiring your office manager? What if you take over a practice and need to fire or transfer the office manager? It's a good question.
partner with your ops team. That's where I would say that's where your territory director, your regional manager come into play. They can help you figure out how to navigate that and do it in the best way for both you and that other employee. They're going to be able to look at it from both sides and figure out how do we get you the right talent in there, but also be able to potentially separate from that employee. Or sometimes it might even be that they're just not in the right role. So we can manage all that for you and kind of take that off so that you can focus on the patients, and we get you the right person in so that you can have that support to build that relationship.
Awesome. Love it. Well, thank you guys so much for all your wisdom. But before we move on to our onboarding team, I do want to share our We Got You program that we have organized for residents and D4s. Brett, if you don't mind sharing your screen so we can show everybody. So the We Got You program, guys, is an opportunity to travel to Chicago with about 20 other students and residents from all across the country. It's an opportunity for you guys to really get immersed into what, Aspen's all about from a clinical perspective. And Dr. Elijah actually Brett, I can share it. I have it.
Yeah, every time I pull it up, it just kicks out the image. I'm not sure what's going on.
No worries. Can you guys see my screen here?
Yes.
Okay, so the We Got You program, again, is an opportunity to travel to Chicago. It's completely covered by Aspen Dental. You join 15 of your peers from across the country to learn, connect, and network with Aspen Dental dentists. We have upcoming sessions this summer. As you can see, the dates are there, June 23rd to the 24th. That already passed, obviously. We have July 14th and 15th, and then August 11th and 12th. If you're a D4 or if you're a resident or a new grad, I would highly recommend you fill this out. This doesn't mean you automatically get to go, but this gives you an opportunity to go. And I would highly recommend it. Dr. Elijah just recently went to the June session. Dr. Elijah, is there anything you want to provide in terms of just like experience-wise, how it was for you, what you thought of it?
Yeah, it was really, really cool. You got to sit down, have dinner, drinks with students, doctors. The first night, the second day, they were able to come travel to the OCC and observe what we do there with our current doctors. And I know I had some jaws dropped from three ladies from New York. They were in residency, and my MCD that I kind of adopted for the day placed 10 implants in front of them, 6 up top, 4 on the bottom. Did it all like a pro, like she's been doing it for the past couple of years. But little did they know it was day 3 of her training, and it was awesome feeling. The program is personal. You can actually get to know the team, the doctors, the recruiters, and I would recommend it because it's just a small little peek into what our daily lives look like, what we're willing to do for the people in our company. And at the end of the day, I think it's a really cool experience to explore what's out there.
Yes. So those of you that are job searching as D4s and residents and new grads, if you have any further questions, we'll be reaching out. We'll send this out to everybody that is a D4 resident. And if you have more questions, feel free to ask. But just wanted to share that with you guys, let you know a little bit more about it. And then without further ado, we're going to allow Paula and Brianna just to talk a little bit about what onboarding looks like, how they help you with that transition, how they are a resource to you all. And yeah, you guys take it away.
Awesome. I am thrilled to spend the last couple of minutes here talking about the onboarding process. So I want to take a quick moment to introduce our team here. We have a ton of extremely talented coordinators and specialists on the back end working to support all things doctor onboarding. So that's going to be in partnership with our academics team, our field operations team. So folks like Megan here on the call, and recruiting. I have the states that our team members support, and they'll be reaching out over the next couple of weeks to check in and support you all during this exciting time. But what our goal is, it's really to simplify the onboarding process to get you all in the door quicker to start seeing patients. So I have Brianna on the call with me. Brianna, I'll turn it over to you to talk quickly about what your day-to-day is like in onboarding.
Yes, absolutely. Of course, like I mentioned previously, I am an onboarding experience coordinator with the team. Our function on the team is to assist with onboarding logistics and journey coordination. We are here for onboarding paperwork support, which could include like I-9s, background check support, along with credentialing and licensure inquiries. We work cross-functionally within the organization to assist with any questions or concerns you have along the way.
Okay, so in terms of what the journey looks like here, so we definitely got you. Once you sign your offer letter with the recruiter or your TAM, talent acquisition manager, as we call them internally, you're officially a part of Aspen Nation. So what happens next is one of the coordinators reaches out to walk you through the process, which will vary by state. So we'll have very specific touch points to support you with and collect any documentation needed to get you through the process. Most importantly, what we want to do is ensure that we're answering your questions and addressing all of your concerns. So while you all are waiting to start, we have also a team of credentialing, licensing, and insurance specialists that are going to be reaching out to start your committee application, which will ultimately grant you committee approval or just privileges to start seeing patients. So what that essentially means is we're looking for things like NPI numbers, DEA certificates, college diplomas, any supporting documentations to have everything ready for day one. So your first day in office, your staff is going to be elated to welcome you in on day one. Again, partners like Megan will get you acclimated with the new space. They'll help you with your systems and IT setup. You're going to spend some time bonding with your staff over lunch. You're going to get to indulge in some company swag, which is my favorite perk of this process. But Brianna will walk you through the first week and beyond.
Yes, absolutely. So during that first week in office, you're really going to begin to get acclimated to your team and to get a feel for the environment in which you will be working with through the new hire orientation, learning about patient scheduling, our APMS programming, where the patient charting is stored. You will also be able to get familiar with the equipment, such as like the iTero scanners and the CBCT machines that they had touched topics on earlier in the call. And along with being able to participate in that new doctor journey program, where you will have the opportunity to learn alongside our incredible clinical support team during a hybrid version of hands-on and virtual sessions to advance your knowledge within the organization. Then within the first 3 months with us, you will be able to partake in the doctor development and mentorship program, partnering with a provider in office to get an understanding of the day-to-day functions. And you will also have the opportunity to learn through courses and fireside chats with Bob on topics such as what we're currently going over now, the practice management, implants, motto, and dentures along the way. And that just really encompasses the first 3 months in office. It's a really great experience to partner with your mentor doctor and just learn during that time. And we did also want to make sure that you are aware of how to contact the team. I sent out the link to the Waiting to Start doctors within the organization. So you're always able to connect with us through that text campaign there. And also you can reach us at onboarding@teamtag.com with any questions or concerns you may have.
Awesome. Thank you so much, Brianna. So I know we're at the top of the hour here, so we'll take any questions around onboarding. If not, what we'll do is we'll send out these resources and we'll follow up with you all via the text campaign that Brianna mentioned.
Awesome. Thank you, ladies.
Yeah, that was great, guys. Thank you all again for joining, and of course with the participation. We'll be sending out a raffle, so we'll pick that either tonight or tomorrow morning. If you are the lucky winner, then expect either an email or a text message from your respective academic manager within your district. And then, yeah, Sammy, if you want to close it out, we're all set.
Yes, I just want to say thank you guys again for joining. I want to big shout out to Dr. Gia, Dr. Elijah, Megan, Brianna, Paula. They all volunteered their time to be on here this evening. Dr. Elijah, Dr. Gia, Megan did not have to come on here, so big shout out to them. I seriously appreciate y'all's support for doing this. Every month we have a virtual learning series, guys, so be on the lookout for it. You guys are more than welcome to join every single series. And we will have raffles on every series as well. And I hope to see you guys in the future. Thanks again, everybody, and have a good night. Bye, guys.